Today I'll be talking on the sample collection for sputum. A sputum is a sample of the gooey substance that often comes up from your chest when you have an infection in your lungs or airways. So checking the sputum is the best way to find out if a particular person have TB. Else, if you are already taking medicine for TB, checking your sputum is the best way to tell if the medicine is working. So to be sure the test is accurate, you must cough up a sputum from deep inside your lungs. Then sputum from your lungs is usually thick and sticky, and the saliva sample should be rejected. So for the collection of the sputum, when you visit the lab, the technologists will give you a special plastic container for collecting the sputum, and this container is very clean, so don't open it until you are ready to use it. So to begin the collection, you have to take a very deep breath and hold the air for 5 seconds. Slowly breathe out, take another deep breath and cough hard until some sputum comes up into your mouth. Then you have to spit the sputum into the plastic container and keep doing this until the sputum reaches the 5 ml line or more on the plastic container. This is about like 1 teaspoon of sputum. Then screw the container tightly so that it doesn't get leaked, and dry the outside of the container with the help of tissue paper. And on the container you write the date of the sputum collected and give the container to the lab technologist. So this is how you collect the sputum. And for the transport, specimen for the transport, the sputum specimen should be placed in a leak-proof biohazard bag with sealed lids and absorbent materials and transported to the laboratory in a cooler with chill ice pack as soon as possible after the collection. So this specimen should be sent to the laboratory as soon as possible after collection in a leak-proof container surrounded by this absorbent material and in a shock-resistant outer package that it is properly labeled according to the national or international regulation for infectious material. So if delay, you have to keep specimen cool in a refrigerator but not in a freezer. Up to a week in a cold condition will not significantly affect the positivity rate of the smear microscopy. However, the additional growth of contaminants will result in an increased contamination rate on culture media if the delay exists up to 3 days. So coming to the transport packaging, the basic packaging system for local surface transport of all specimen consists of 3 layers for this sputum. So the primary receptacle is the specimen container packaged with enough it should be packaged with enough absorbent material to absorb all the fluid in case of leakage. Then the secondary package, a second durable watertight leak-proof packaging to enclose and protect the primary receptacles. Several cushion primary receptacles may be placed in one secondary packaging, but sufficient additional absorbent material must be used to absorb all the fluid in case of a breakage or any leakage. So for cold transportation condition, ice or dry ice shall be placed outside the secondary receptacle. Wet ice shall be placed in a leak-proof container. And for the outer packaging, secondary packaging are placed in outer shipping packaging with suitable cushioning materials, and outer packaging protects as this outer packaging protects their content from external influence such as physical damage during the transit. So for the surface transport, there is no maximum quantity per package. So and also for the air transport, no primary receptacle shall exceed 1 liter for liquids, or the outer packaging must limit for solid. So the volume shipped per package shall not exceed 4 liter or 4 kg. So for the direct microscopy, this direct microscopy examination depends on the demonstration of characteristic asexual spores, hyphae or gaze in various clinical specimen by the light microscopy. And for the culture, fungal culture is frequently used method for confirming the diagnosis of fungal infection, where SDA is most commonly used for used medium for fungal culture. Other media include CHROM agar and the blood agar, etc. So other and the serological test includes the complement fixation test, the ELISA, and the Western blot and radio amino assay. So this is all about the sample collection and processing of the sputum.